There are many known adverse effects of opioids. Some of them are bothersome, and some of them are dangerous. Let's face it, the worst thing that can happen on an opioid is a pharmacological and physiological effect of the drug. They delay your respirations. Not only do they delay your respiratory rate, how many times a minute you breathe, they delay your tidal volumes, how deeply you inhale and exhale. So that accounts for what we call your minute ventilation, which is why we read about overdose-related deaths related to opioids, because they delay your respirations to a point where it could be dangerous or life-threatening or lethal. That's the worst thing that can happen. The more bothersome side effects are things like constipation. I've read that constipation is probably the most bothersome side effect. And it's funny, when you do a lecture to ER clinicians, they'll tell you that they see constipation every day in the ER. Imagine that, people coming to the ER because they can't poop. But that's how bad a problem it is. So it turns out that the scientists, and brilliantly so, developed a naloxone-like drug, an opioid antagonist, that doesn't cross into the blood-brain barrier. So it doesn't affect analgesia, it doesn't cause withdrawal, but it reverses the opioid receptors in the rest of the body, including the gut, which we think are responsible for constipation. So many clinicians will see these new classes of drugs that are specifically FDA approved to treat OIC, opioid-induced constipation, which work just the way that I told you. They block the opioid receptor, so the opioids don't bind in the gut, but yet they're big, bulky molecules, they're charged or polarized, they can't get through the blood-brain barrier, and therefore they don't affect the analgesic effect. You know, I've said it often enough, there aren't too many places in medicine where we have an antidote or an anti-venom for a problem. This is one of them. This is kind of like an antidote for the binding of the opioid receptors. So a novel class of drug to change an age-old problem of opioid-induced constipation.